Thank you. So I'd like to invite the panel members, Dr. Fraker, Dr. Rubin, Dr. Busta, and Dr. Johnson to come to the podium. And to save time, since you have Dr. Johnson, Rubin, and Dr. King have already been introduced, I'm going to skip introduction to them and would just introduce to you Dr. Frank Busta, who is the Director Emeritus of the National Center for Food Protection and Defense and Professor Emeritus of Food Microbiology at the University of Minnesota. So as I said, I would like each of the panel members to start by giving 5 minutes or so presentation of their own thoughts, and then we'll open it to discussion. So who would like to start?
I'll start.
Okay, great.
First of all, if you look at my resume, I am not a nutritionist by trade. And so today and yesterday I've been absorbing and appreciating all the presentations. I just have some thoughts. I can't help seeing some I'd like to put on every food that appropriate use extends life, excess shortens life. We just put that on all the foods and have that claim, and I think we could get away with that claim. As I was listening to this, your concluding comments, successful aging is living. You know, if you think about that, it's living. It's interacting with people. It's involved. It's, you know, even if you have an illness or a disease, you bypass that and you live. And as I looked at the things that extend our lives, help our aging, the nutrition, the exercise, and I listened to all this input, it's the ability to really live that makes aging tolerable. And I'm in that category. I look at those numbers, I'm at the top number all the time, and that's very unnerving when you watch the curve go like that. It's sort of unnerving as to where we are. As a microbiologist, I'm delighted that we're finally looking at a microbiome, and I think over the next few years we will find a tremendous influence on that, which will interact with all of our nutrition knowledge now and what we will learn in the future, so that we really understand that whole package. Because what we ingest, in part we use directly, and in part we just support our microbiome. And so I think that will have a tremendous aspect for the future, and I think that will be a major part of our healthy aging. We've got a number of microorganisms that are possibilities. I'm not sure we're any farther along on that than we are on the chemicals that we were noting in the last presentation yesterday as to what would supplement our nutrition to take place of reduced consumption. As I listen to what we should be doing, are you timing me?
Yes, you can see actually here if you're worried. When it becomes
still green?
Yellow, then you know that you need to sort of wrap up.
As I was listening yesterday, and we want bone structure, and we want skeletal muscle, and we want digestive tract healthiness, and we want appropriate weight, and we want a number of these other aspects, all to make us age better. I've found that there's a real challenge of choices. I know some older people, older than I am, who say their whole life is exercise and eating. That's all they do all day, is they've got a number of exercises they need to do, and they need to prepare their food and eat the appropriate food, and that's about all they do. I think the social aspects are extremely important. Behavior modification, I didn't really hear very much about in our presentations. And I think that is terribly significant. I personally find challenges of doing what I know I'm supposed to do. And I think that's not unusual of the amount of food that I should eat, the appropriate food I should eat, the handling the advertising and marketing of what's enjoyable, our entertainment, our activities, our enjoyment, all associated with food. And so putting a behavior change into appropriate diets to relate to our aging seems to me to be a tremendous challenge. That some people are capable, but a lot of people are having a hard time with that. And I know a number of people, especially those that are suffering from extensive overweight or obesity, who are really elderly, who say, I'm going to enjoy myself. If it cuts 5 years off of my life, so be it. I'm going to just enjoy myself. And I think Gordon's presentation yesterday was referred to that. If you see an extremely obese person that should lose 100 or 200 pounds and they're 85 years old, you don't say, you need to go on a severe diet. You sort of try and help them get along.
So I think on that very nice thought, maybe your
My
6
time's
minutes.
up?
Yeah.
Okay.
So maybe we can come back to some of the thoughts again at the end.